Hey guys, Jill here from Ask a Vet Tech. So we're going to talk all things dog and puppy vaccine related today. I'm going to talk about each of the viruses that we are using vaccines to protect against, a little bit about the disease so that you know why we're vaccinating against it. I'm also going to give you a little bit of information about dog test titering. When the puppy is born, it is born with antibodies from mom. And these only last about 5 to 6 weeks. So at that point, your puppy's immune system starts to tank off. And that's where vaccines come in. We start vaccines at 6 weeks and not before. We don't want to mess with mom's antibodies. Vaccines work by introducing agents into the pup's immune system to produce their own disease and virus fighting antibodies. They're super important. We're going to talk about some core vaccines first, and then we're going to talk about some other ones, but they're not considered core by the CDC. The most important vaccine that I can recommend, known as the 5-in-1 or the DHPP. It's canine distemper virus, hepatitis virus, parvovirus, and parainfluenza virus. The first one we're going to talk about is canine distemper. It is an upper respiratory, gastrointestinal kind of nervous system virus. It's airborne. You can get it off food and water bowls, and mother can give it to her young. The next one is called hepatitis, formerly called adenovirus. It comes with its own host of problems, such as fever, vomiting, hemorrhagic diarrhea. If you don't know what that means bloody diarrhea, abdominal pain, dehydration, conjunctivitis of the eyes, and they can get little tiny hemorrhages called petechial hemorrhages. The next one that I'm sure you've heard of is parvovirus. That one is an evil one. It causes them to be lethargic, depressed, lack and loss of appetite completely, followed by sudden high fever, vomiting, and severe bloody diarrhea. The reason that this one is so bad is because instead of just having normal diarrhea, the diarrhea starts to shed the intestinal lining, which weakens their immune system, which can cause them to be super weak for a long time, or it can result in death. Canine parainfluenza. It's closely related to the canine distemper virus. It's super highly transmittable. It's a respiratory virus, most common cause of like the canine cough or breathing problems later on in life. The DHPP vaccine is given between 6 and 8 weeks, again between 10 and 12 weeks, and one more time between 14 and 16 weeks. And the reason we booster it 3 times is to make sure that we get enough antibodies built up from the pet, from their own immune system, to protect them against those viruses in the future. The next core vaccine I'm going to talk about is rabies. That vaccine can be given between 12 and 16 weeks, and then it will be good for 1 year from the date of the last vaccine. Rabies causes cranial nerve dysfunction, weakness, paralysis, seizures. They have difficulty breathing, difficulty swallowing, and on top of that, they have excessive salivation, really abnormal behavior, aggression, and then they start to bite themselves or try to bite others. The drooling is the most common. They also can go really stiff. At this stage, there is no survival rate. Now I'm going to talk to you about a few other vaccines that I feel are super important, but they're not considered core or mandated. Hey, since you've made it halfway through this video, if you wouldn't mind hitting that like and subscribe button, I'd really appreciate your support. And I also have a Buy Me a Coffee link below where you can support the channel and help with the growth, if you choose to do so. If not, if you could hit the share button and share this channel with a friend, that's also super appreciative and costs you nothing. The first one I want to talk about is Bordatella. Bordatella is a terrible kennel cough. Bordatella symptoms, if your pet were to contract this, would be a dry hacking cough that's followed by retching. They have a honking sound when they cough, and there's usually a lot of nasal discharge that's kind of watery. Mild cases, dogs will still continue to eat and be alert and be normal, but they just have this terrible cough. Other dogs that are not as strong, they get very ill with this and need antibiotics to get through it. This can be picked up from the kennel, dog parks, nose-to-nose contact with other pets that have it, or it can be aerosolized. It's just best to vaccinate for it. There are 3 types of vaccines you can use. One of them is a normal traditional subcutaneous vaccine that goes under the skin. There is a nasal vaccine that goes up the nose, and there is an oral vaccine that goes along the gum line. I prefer the oral vaccine or the injectable vaccine. If you have to fight with a dog to get a vaccine up their nose, you probably aren't getting it all up in there. Depending on the choice of modality of getting the vaccine, whether you do the injectable, the nasal, or the oral, it can be a one and done vaccine or it can be a 2-part series, starting between 10 and 12 weeks and boostering it at 14 to 16 weeks. The next vaccine I'm going to talk to you about is Lyme disease. Lyme disease is carried by ticks, and it is very, very preventable as long as you are willing to do the vaccine and give them the preventatives. Lyme disease can be very crippling. It causes swollen joints and fever. In some pets, it's a lifelong disability. You can start the Lyme vaccine as early as 10 to 12 weeks and booster it again from 14 to 16 weeks. The next vaccine I'm going to recommend is a Leptospirosis vaccine. Lepto is a spirochete bacteria that lives in puddles and streams. It is carried to the water by deer and raccoons who urinate into the water. Leptospirosis is a zoonotic disease, meaning that you and I can get this from a pet who has leptospirosis. Touching any of their bodily fluids can transfer that right through your skin and make you sick as well. The symptoms that this virus presents are lethargy, vomiting, diarrhea, fever, unexplained muscle weakness, urination, more thirst than normal, and drinking excessively. You may notice jaundice or yellowing of the eyes, the skin, the lips, and blood in the urine or feces. Leptospirosis could be fatal if left untreated. You can vaccinate from 10 to 12 weeks and then again at 14 to 16 weeks. The last vaccine I want to talk about is the canine influenza virus H3N8 and H3N2. The canine influenza vaccine is a 2-in-1 protection against both strands of the canine influenza. It reduces incidence of severity of cough, ocular and nasal discharge, depression, and trouble breathing. It also helps to protect against the formation of severe lung lesions. You can vaccinate a healthy dog between 7 weeks of age and older against the canine influenza virus. Typically, you would booster this vaccine 4 weeks after the first injection. It is a yearly vaccine. It is something that would be highly recommended by a veterinarian if you were to be at a boarding facility, traveling regularly with your pet, and stopping any place that they could be exposed to other pets, like the dog park or rest areas. The hope with this video is that you would learn some new things about the viruses that are out there and how to protect your pets against them. Vaccines are not nearly as scary as a lot of people make them out to be. I truly do believe in the vaccines as protecting pets' lives. I've seen it on the other side, and trust me, you don't want to be there. So how do vaccine titers work? Where the veterinarian takes a sample of their blood and sends it into a laboratory to find out if the vaccine has been active in your dog's system, if you need to vaccinate again or not. Some people decide to use vaccine titers to decide whether to revaccinate a pet on its scheduled time. The basic idea is that if your pet has had enough antibodies to protect them against a disease, revaccination against the disease may not be necessary. It kind of makes sense. It is important to note that this only applies for the following vaccines: canine distemper, canine adenovirus, canine parvovirus. That's it, just 3 of them. It's important to note that the titers do not matter for rabies vaccine. The titers for rabies vaccine can be drawn, as you can see in this paper here, but it is not indicative to whether or not you should or should not vaccinate. Rabies, by law, in Michigan at least, you are required to vaccinate on a schedule, and there's no variation from that, no matter what your titer says. So legally, you are bound to do it. If you have any questions or comments, please leave them below. I'd love to hear from you. And if you haven't already, please hit that thumbs up and subscribe, and hit the bell notification so you don't miss a thing. I'm here for you. You're here for your pet. Have a great day.